Alice Benson. I'm the clinical director at the Chattanooga Autism Center, and I'm a clinical social worker, so I was glad to hear one social worker in the room. And this is Megan Just, and she's our stages. Oh, she got married.
I just got married.
Yeah. And she does our stages program. So I don't know if you want to tell a little bit about stages. But.
Basically, we do independent living skills, social communication skills, and vocational skills for adults on the spectrum or with similar disabilities. They have to be 18 to be in our program up until we have a 32-year-old. So we work on skills in the Autism Center, in the community, in their home, based on the principles of applied behavior analysis.
We love students. We have lots of interns.
Yes, that are very helpful.
So thank you guys for being here. All right.
Do you want me to stand with you? Stand over here.
So current data on autism and prevalence of autism is, as of 2014, this is the most recent data that's been presented by the CDC, that it's 1 in 68 children who have autism, 1 in 42 boys, and 1 in 189 girls. And it increased, since 2000, the prevalence rate has increased by tripled since 2000. So we believe the numbers are still higher, and there's different factors for that, but definitely if you don't know of somebody who's already been diagnosed, you probably have worked with somebody or know somebody in school or family members who may have autism but have never been diagnosed. So common characteristics of autism are the adaptation to change and response to stress is often difficult for people on the spectrum. An overall fear and nervousness tends to be prevalent, and that's usually related to new situations or social conversations and communication often produce fear and nervousness. A lack of environmental awareness and lack of emotional recognition. And we'll be talking more about each of these during the presentation. There are advantages to having autism. And in working with children and adults, I really try to focus on these advantages because they really are unique, and a lot of times people with autism often feel very different and therefore have lower self-esteem and struggle in many situations. And so talking about the advantages of it, I think, is very important. Some of the advantages are ability to focus or hyper-focus, especially on things that they really enjoy. Sometimes that can be a disadvantage because you can't get them to stop doing what they're wanting to do, but it's definitely something that's an advantage, and you can use that in working with them. They also have these really great ways of thinking about things and looking at a situation that's different than what they call us neurotypicals. And so I always am saying, your mind is so much cooler and better than my boring mind, which it's true. But they have this ability to have really good attention to detail, and I don't know, they just notice things that I would never pick up on. They're really to the point about their opinions and will let you know how they feel. You know where you stand with them, and that can be a good thing or sometimes a negative. But I do think that there's lots of advantages for children and adults with autism. Okay, so kids with autism, they'll share many traits, but not all kids with autism are the same. And so this oftentimes is a misperception, especially for somebody who knows one person with autism. So, autism really is a spectrum, and you can, one child may be nonverbal and have very limited communication, while another child may talk a lot and doesn't really know when to stop talking. So it's kind of this extreme ends of the spectrum, and it's very different based on a child's personality, and so you can't just assume that because one person does one thing that with autism, that means somebody else you meet would be the same. A lot of times we do testing at the Autism Center, and parents will come in and say, well, my doctor sent us for an evaluation, but my kid has great eye contact. There's no way they could have autism because they have really good eye contact. And that's just not a criteria. A lot of kids do struggle with eye contact, but that just because they do have good eye contact doesn't mean they don't have autism. Okay, so one of the common problems or difficulties that kids with autism have is verbal delays or communication struggles. Verbal delays, let me see. I can't read this, sorry. So they may have problems with auditory processing is often very difficult, and that is, if you are telling them something, then it takes a few seconds for them to listen to that information, interpret that and process that, and then be able to respond back to it. So putting the words and sentences together to give you an answer back. So sometimes, you get this kind of blank stare for a couple of seconds while they're thinking through what was just said and beginning to respond to it. Children, one of the differences that I was describing before, they may or may not have a language delay. Some children with autism often will have very limited communication before the age of 3 or 4. So they may have a few words that they say, but don't have kind of conversational language or making full sentences. Some will have normal conversational language development, but most do have some delays in language. Another thing associated with communication delays is understanding not just verbal language, but nonverbal. And so oftentimes a child with autism will misinterpret nonverbal cues or not even pay attention to nonverbal cues. So those things, yawning when you're kind of tired of listening to the speaker, or looking away when you're getting bored with the conversation. They might not notice that. Usually won't notice it. And if they do notice it, it sometimes doesn't change anything. They'll continue to talk about whatever their favorite subject is. Let's see. So some ideas and hints for working with children and adults with autism is to keep in mind that that most people with autism tend to misinterpret other people's reactions or response, often to the negative. So just be very careful about, trying to have a very neutral stance in your tone of voice and how you're interacting with someone on the spectrum, because they just tend to be sensitive to things. I saw you nodding your head, but even if you're just trying to help and say, oh, don't do it this way, let me help you, we can go over here and do it this way, then they may just feel like, wow, you're correcting me, and you don't like me, I did something wrong, and can kind of really misperceive something very minor. So just pay attention to that. Children with autism, and this is one of the fun things, are very literal, and children and adults, not just children. But so I don't know, we laugh a lot about some things that come up. So they don't really get, in the South we have a lot of slang that we use and idioms that we use, and they do not get that. They don't understand what that means. One of someone in our office today, she was saying, I was telling her about the presentation, and she has a 4-year-old son with autism, and she said, oh, I was sick a month ago, and I was walking around saying, it feels like I've got a frog in my throat. And he was like, you have a frog in your throat? And then so she was trying to explain to him, no, it doesn't mean that, it's scratchy and I'm hoarse. And then he was like, you're not a horse. And so those kinds of things. And often we forget until we have these reactions from them about to what we're saying, and then it's like, oh, wait a minute, let me rephrase that. So be careful about what you say. Be very direct, say what you mean, try to be as literal as possible, give really concise directions. It's helpful if you can give specific and brief directions. Don't give too much information. And, just give like one or two directions or expectations, and not say too much, because then with that processing that's difficult for them, that can become too much information and overwhelming and confusing. Be as concrete as possible, especially with time. When you're trying to give some advance warning about, we're going to stop this activity in a couple of minutes, then don't say in a few minutes or in a little while. Say 2 minutes or 5 minutes, and as much as possible, because they are visual learners. Then do a timer, and it's so easy now with phones you've got a timer right there with you all the time. So things like, we're going to do that soon or in a little while, they don't understand what that means. So just be very specific. Another tip for working with children when thinking about language is don't use sarcasm, because they don't understand that and will misinterpret that. Be clear with your questions, and do not rely on nonverbal communication, because they probably won't pay attention to that. So don't give, like, if somebody's doing something wrong or something that they shouldn't be doing, don't give like the mom look, because they're not going to notice what that means. Special interest. So all people with autism have an interest, an intense interest in something, and it changes over time, but they always have almost seems like an obsessive type of interest. Little kids, we see Thomas the Train is really common. It shifts to dinosaurs. Then somehow it shifts to the military. I don't know why that is, but I have, like a middle schooler, and he keeps a notebook of World War II military artillery vehicles, only the artillery ones. Not even sure what that is, but he has a whole notebook of all the vehicles, knows all the specifications, can talk about them as long as anybody will stand there and listen or pretend like they're listening. So the interest can change over time, but there is always something that they're kind of obsessed about, and they want to talk about it. They want to play with it if it's a toy. It's just, what they want to do. And we know now that engaging in that activity is relaxing for them. So that's kind of their way of calming down when they're overwhelmed or need to escape a little bit and take a break. So you can use those interests to your advantage. This also talks about how with that interest, the kids will hyper-focus on that, and that will be, they can, like I said, the specifications on the artillery vehicles, he could name every single one of them. Things that, most people don't even care to know. So how can you use these interests when working with the kid? If they are beginning to get overwhelmed, or you notice that they're uncomfortable, or maybe are by themselves and you're trying to engage them, then go and ask about something that they like to do. It's good to find out from a parent beforehand what their interests are, and then I think Caitlin gets this information before children are dropped off for parent night out.
They sign up online, and they tell me before they even come to the thing what their preferred calming methods are and what their interests.
Yeah, so if it's Thomas the Train, and you can just, tell me about Thomas the Train, and they will tell you everything about Thomas. And it allows them an opportunity to do something that they enjoy, but also to kind of distract and help them kind of calm down or get more comfortable with the situation that you're in. So use those. In therapy, I will put whatever they're interested in. I thank goodness for Google Images. I can pull that and put it on worksheets and stuff that we're doing, and it's a lot more fun if Thomas is on that sheet than just a plain old notebook sheet. It is difficult to get them to stop talking about whatever their interest is. So sometimes you may have to allow a certain amount of time. Something that I do is I'll set a timer and be like, we'll talk about this for 5 minutes and then we're going to go do this activity. And the timer as a visual really, really works to help them know, okay, we're finished talking about it. Stress. One of the best things I learned when I was a student and being trained in autism was that all children with autism and adults with autism have anxiety. They have some level of anxiety. And that level of anxiety changes based on situations that they're in, or, for most of us, if we're at home in our pajamas, then that's our comfort zone and we're relaxed. Then you start to throw in going to trainings and new people you don't know, and going to the doctor and things like that. Everybody's anxiety increases. But all people with autism on some level have anxiety all the time. So remembering that and interacting with them with that understanding, I think, is important. With children, you may see, because of the anxiety, and you don't know what could trigger it, but where they may be fine, and then they're falling out, and there's a full-blown tantrum quickly. I mean, it's like 0 to 60, and you're just like, what happened? Somebody turned on a light or walked out of the room, or, it can be very, very minor. And tantrums can look different for each person. Little kids, it seems to be under the table. They hide. They got to escape, get under the table, behind a chair somewhere, and get away. They're trying to get away from everything. And then with older people, it may be pacing and moving around. So it's different for everybody, but pay attention to their reactions and response, and be aware that anything can increase the anxiety. Let's see, triggers, I was just saying, is usually can often be undetectable. So don't doubt, don't assume that something didn't trigger it. It's just something maybe we didn't see or notice or pay attention to. Transitions are often a trigger. And so stopping one activity and having to go to the next one, even if it's an activity that they don't enjoy, just having to transition is difficult. So as many times this has unstructured environments is also overwhelming. Doing better with routine, being able to understand, and know what to expect. So you guys, did you all kind of know that we would end at 7? You were aware of the time? So that helps. Like, this isn't going to go on all night. I'm going to get out of here at some point and get home and do what I need to do. So think about that for a child with autism. As if they just come into a room and don't know what the activities are and don't know what's expected of them, they don't know, what's going to happen and when it's going to be over, then that increases anxiety. And it does for all of us. So as much as you can show them visually or prepare them that here's what we're doing, we're going to do this activity and then this activity, and then mom comes and picks you up. Then that just allows them to relax and they know what's expected, and then can do better moving through the activities and with transitions.
Sometimes writing that on a piece of paper can help too, an actual visual. So just grab a sheet of paper and write those things. And once we finish story time, do you want to check it off? You're in control of what we're doing. Really gives them some ownership of their time. So instead of it being you're in control of what I'm doing during this childcare experience, I feel like I know what's going to happen, and this piece of paper is kind of my guide.
Yeah, and even for adults. We kind of do a lot of these things for children, and because we think it's a child and we need to better prepare them, it's true for adults as well. So don't underestimate the value of paying attention to these things and following suit. Okay. So we may have covered some of this. Some ideas to deal with transitions and the stress is scheduling downtime and offering time for a break. So I don't know, even if it's just like, let's do this activity and then we're going to take 2 minutes or 5 minutes and go to another room that's quiet, or take a walk around the room for a few minutes and then come back to the next activity. Breaks are huge. I don't know, a lot of us take breaks. I'll at work, I walk around the building or go to the restroom where it's quiet. At home, take a break in the restroom, and hope my kids don't follow me. But, we all need those 5 minutes to kind of just take a few deep breaths and then come back to what we were doing. Providing a quiet space is important too, so just where they can take a break. So just think about a quiet room. Maybe they can get away from everything that's going on, not just the activity, but visually, the noise and the people, and go somewhere and do something they enjoy for 5 minutes, play on an iPad or a phone, and then come back is good too. Another way to help with transitions is to allow them to take a favorite toy with them from one activity to the next. So like at the Autism Center, the waiting room, sometimes they're out there playing and then I come and try to get them to come back to the office with me. And if they can just take like one Thomas train or a toy of whatever they choose, one thing that they can hold and go from one room to the next. It's like this transition item that makes them feel more comfortable and is something you can utilize. This says, and I don't know that you would do this, but do not use the child. It's good to give them tasks and activities. One thing you don't want to do is make them the monitor. So I made some people here the table monitors. That would not be like a good idea for somebody with autism. Or the room monitor at school where they're having to write down who's talking. They take that very seriously, too seriously, and often don't understand that can lead to, some kids are going to make fun of them because of them being, we call it the rule police. So don't encourage that. I had a high schooler who I was just like, you can't send him to school the next day because he's going to get his butt kicked. But he, on the bus on the way home from school, somebody littered out the school bus, and he called the police because there's those no littering signs that say to report if somebody litters. And so he called the police from the bus on the high school kid. It's like, oh, you're going to be in so much trouble. But he didn't understand. To him, it was like, well, he littered. He's not supposed to. He knew better,
I know what to do about it.
The sign tells me what to do. I'm supposed to do that. Anyway. All right. Any questions before I hand it over to Megan? Yeah.
I was curious about getting hints. We do some things with logic and reasoning, and they're the only things that we don't get a direct answer to. How would you maybe guide a child through that to get them to use logic through a puzzle without getting hints? Is there a good way around that?
In what situation is that?
We give different logic puzzles. Sometimes it's just things that they have to figure out, and some of the data is inferred in that.
Yes.
So you normally just get hints and try to kind of get them to come to a conclusion on their own. But what might you do when you look at in that situation?
I think in that situation, it's okay to give hints.
Okay.
Because inferring information is not their strongest skill.
Okay.
And so most likely they would get frustrated and want to pull back or shut down. So I think in that situation, it's okay to give some hints and help kind of guide them.
Well, thank you.
Yeah.
So a lot of our work is like a predetermined amount of time, right? And work for an hour and then you're free. If stress happens halfway through the session, are there certain tips to help that child calm down without actually having to completely derail the session as a whole and end it right there? Is there something that we could do with that child one-on-one for a small amount of time that would help them calm down without having to take them to a separate room or without having to take them back to their parents?
even just taking a break from the activity, so like taking whatever you're working on, we're gonna put it over here,
For
and
30
let's do
seconds.
something for 5 minutes, and then we'll come back to it,
Okay.
is helpful.
If
But-
you've had an experience the last session where it was a big issue, you could come in with a plan and say, we're gonna do 5 math problems, and then you can tell me about giant squid or whatever your pervasive interest is for 30 seconds. But then we're gonna come back and do 5 math problems, and we're gonna keep doing that until we get to an hour. So that way, I mean, everyone needs these little tiny breaks,
Yeah.
especially if you're working on something that's really difficult and aversive to you. So kind of tailoring it to what they're capable of doing.
Yeah.
So if you know that you went 5 math problems without a problem, maybe you should stop at 5 instead of trying to go to 10 so that you can be successful and have a positive experience.
That's great, thank you.
And having some, I call them fidget toys, but things that they can do while they're working. So some handheld kinds of things they can squeeze and turn and play around with is also a good just activity to have to help decrease the stress
Okay.
and get them maybe to 6 problems. So.
Yeah.
Yeah, and that's an important thing too. If you've done 5 problems in a row for 3 sessions and they were successful, you can then maybe push them a little bit and maybe then also give them a little bit longer break. So today we're going to do 7 problems, but you're going to get a 45-second break instead of a 30-second break. Kind of a trade-off.
Thank you.
Anything else?
Any other questions? All right.
Something else that, can you guys hear me okay? I kind of have a cold, so I'll try to talk loud. Something else that you might see is some body awkwardness. You know, if you're not socially aware of the way that people are viewing you, sometimes it's not a priority, or often with autism, there are some physical limitations, fine motor skills, gross motor skills, that can be difficult. So if you see someone, a lot of times you see kids with autism walking on their toes, they're not dancing. That is something that probably an OT or a PT is working with them on. So being kind of cognizant of that and being aware that sometimes other kids might say, you know, why are you doing that? And kind of coming up with an answer about, you know, we're all different, we all do things different. And if you see that there are some of those limitations, being really careful about pushing that child too far outside of their comfort zone or outside of their ability. So a lot of times kids with autism are not very athletic. So if you put them in a situation where you're throwing a ball around or something and that kid's really having a difficult time and getting hit in the face because they can't catch the ball, you might want to pull them out of that situation because it's probably going to escalate into something that, you know, if they're not really having fun, if you're working with Caitlin, the point is for them to have fun. So you don't want them to go home and be like, Mom, they hit me in the face with the ball over and over again. And that might be something that you check with before parents drop off to. Is there anything that they really don't like to do or that they have a really difficult time doing? Sorry. I've had kids and adults tell me that writing can actually be painful because of those deficits. So a lot of times, any of you that have been in a special needs classroom, they have adaptive, it kind of looks like a ball, or maybe it's a big giant pencil instead. If they're really having difficulty coloring or something, again, just not pushing the issue. I talked about balls. Again, I talked about this. Just sort of minimizing those activities where it might cause an issue. So if you have 5 children with autism in the childcare setting, and you know that 4 of them have an issue with fine motor skills, maybe we sing a song, or maybe we read a book, or do something that we know is going to be a really positive, fun experience for everyone. Oftentimes, kids and adults with autism are referred to as little professors. So oftentimes, kids with autism understand really big words or can tell you really big words, say really big words before they have an understanding of what that word actually means. So they may be talking to you and reciting a physics textbook that they like to read in their free time. But if you start asking questions about what they're actually talking about, they may not be able to respond to you, and that's a pretty normal phenomenon. Sometimes my voice when I'm talking goes up and down. If I say, "Would you like a cookie?" you know that's a question. Sometimes that doesn't happen, so they may be asking for something, but it sounds to you like they're saying a statement. Being aware that sometimes their voice may sound a little different. They may also use words in the wrong order. So if they need to go to the bathroom, they might say, "Do you need to go to the bathroom?" because that's what they're used to being asked. Pronouns often get mixed up a little bit because someone's asking them, "Do you need to go to the bathroom?" But what they need to say to you is, "I need to go to the bathroom." And it's okay to use that as a learning opportunity, I think, to say the right way to say it to them. Did you mean I need to go to the bathroom? Okay, let's go to the bathroom. Also, kids with autism, sometimes they have difficulty with something called joint attention. So if they're trying to get your attention to show you something really cool, I'm going to point at it, I'm going to say, "Hey, come over here, look at this cool whatever that I'm looking at." That might not be happening, so if they're not able to get your attention, it might become, "I'm frustrated, I'm going to drag you over here and show you this really cool thing." Just in a way that they don't always understand our social cues and sort of our nonverbal language, they might not know how to speak that way to you as well. Often something that we see is facial expressions that don't match what they're trying to say, like "I'm really mad" and they're smiling, or they're smiling and they're crying, and you're like, "What's going on?" We work a lot with kids with autism on recognizing facial expressions. It's something that's really difficult for them to do. So if things don't seem to be quite the way you would think they would be, that's okay too. Also, often kids with autism participate in something called parallel play. So you'll see a kid with autism sitting beside the sandbox, kind of looking over at the other kids that are building a sandcastle or making trucks go up and down over mountains that they've made. And the disconnect is between, I really, really want to be involved, but I'm just not really sure how to jump into that conversation or into that playtime. So being able to recognize that when the kid obviously is close by some other kids that are doing something that's really fun, grabbing them and saying, "Hey, do you want to grab a truck and go over the mountains too?" Or often you can use a peer buddy and say, "Hey, would you go ask Johnny if he would like to be involved in your playtime?" Parallel play. So I'm sitting next to you, we're not intersecting. And often sometimes, they may be trying to interact, but they also may be trying to get as far away as possible because I brought this really cool thing with me and I don't want to share with anyone, and I want to sit in the corner and talk to myself about my truck that I brought with me because it's so cool. Trying to also find ways for that kiddo to interact. It's not always their preferred thing because sometimes other kids don't play the way that they want to play. They don't follow the rules that they kind of have for their playtime. So attempting to get them to engage with peers, but also being mindful that sometimes it's something that's really difficult for them. They also might, I think this is nice. They might interact with you in a more effective way than they do with a peer. Again, because adults usually are more adaptable and able to figure out what the rule is to their game, where another kid might just say, "No, you can't take my toy, why are you doing that?" You kind of have more reasoning skills and can figure out what the issue is and manage that. Oftentimes, I find that the bossy little girl in the group is a great peer buddy. For some reason, it seems like they always pair up, the kid with autism and the bossy little girl. For some reason, that little girl is able to get them to do whatever she wants them to do. So if you see that interaction happening, that's a really great way to involve peers, is getting that child to sort of be your voice. So could you go tell Johnny that it's time to go to the bathroom? Because that might work better than you trying to tell him it's time to go to the bathroom. When you're trying to get everyone to interact in a group too, if everyone sort of has a specific job, so it's your job to pass out the crayons and it's your job to pass out the paper, and would you like to choose what our picture is going to be today? If everyone kind of has something that they're supposed to do, that can feel more comfortable too, because again, if this child feels sort of in control of their time and of their activities, a lot of times it goes much more smoothly. I often tell people that interacting in a neurotypical world, I've had multiple individuals on the spectrum tell me this, that it's almost like dropping you in France and you don't speak French. So you look like a human and maybe I can point to what I want, but I just can't get you to understand me. That could be really frustrating. If you really need to use the restroom and you don't know how to say in French, I need to use the restroom, that's going to be a really aversive situation for you and going to bring about a lot of negative feelings.
I have a quick question.
Yes, sure.
Before we get too far into
Sure.
that, besides that, talking about expression and what they're saying, in those situations, is it always you trust what they're saying and don't trust the expression, or is it the child?
I think it's your job to interpret what is going on. So hopefully, the question was, if you are having a disconnect, if you're seeing a disconnect between facial expressions and what the child's saying, so I'm smiling but I'm really upset, I'm crying and I'm telling you I'm really upset about something, she's asking which one of those are a more reliable measure to kind of figure out what's going on, and I said neither. It depends on the kid. Maybe Alice said this, but there's a saying, if you've met one kid with autism, you've met one kid with autism. There are characteristics that are shared, but that doesn't mean that every single kid that you meet is going to interact in the same way. And so I think it takes a lot of context in that situation. So if you know that someone if you're smiling but crying and someone just came over and took something from you, you can kind of infer, okay, you're probably upset. Does that make sense?
Along with that, I was wondering, there's a pattern that you're saying that you can understand they might routine, but is it okay to assume that they will stay in that pattern? For example, that expression may come with that same behavior, but it may mean something different.
I think the answer is yes. I think if I understand what you're saying.
That we can't.
That the next time that happens, it might be a smile and an upset voice. That the consistency will be there. I think not always. Again, working with individuals with autism takes a lot of your energy putting into interpretation. So you are the individual with autism and you're saying to me A, B, and C, and I have to take that, what I know about you, what I know about the context, and use my brain to try to interpret what you're needing and wanting from me. And a lot of times, I'll touch on this too, a lot of times kids with autism don't have vocal language. And so they might sign. They use something called PECs, which are little pictures. Just because they're not able to verbally tell you what they want, they might have other communication methods. And sometimes telling you what they want is really difficult because they may not have yet had time to internalize and process what the feeling is. We spend a lot of time with individuals with autism learning to recognize feelings within yourself, because I know I'm upset, but I can't tell you why. Just being patient, really, very patient. Alice kind of talked about this too. If you say, in 5 minutes, we're going to go outside to the playground, in 5 minutes, you better go outside to the playground, or that kid is going to be pulling at your shirt saying, you said it was time, and at some point that's going to cause a meltdown, or at least someone that's really upset. So being really careful with what you say so that you can be consistent. Mean what you say what you mean. That makes everyone happy. If you are not able to do that, say, we're supposed to go outside, but it's raining, you also have to be really creative. And probably my best advice for that is distraction. Oh, you like Thomas the Train? Would you like to go draw a Thomas the Train picture? Would you like to watch a Thomas the Train video on my phone? Using that special interest anytime kind of that emotional escalator is going up can help bring you back down. Oftentimes, kids with autism have sensory issues. So I can't tell you how many times I've seen a kid with all the tags cut out of their shirt, or if I know now you can get those tagless shirts that really just that little nagging on the back of your neck can really bother you. Doing arts and crafts can sometimes be really aversive because I don't want to get dirty. So if they're expressing that, not pushing, it's not your job in this situation to push them to get dirty if it's really not something that they want to do. Try to come up with sort of an alternate activity. So maybe we use crayons instead of paint, and you still get to create a piece of art to take home, but I'm not going to make you get your fingers all dirty because that's going to upset you. Noise is also a big one. When we do this presentation at the CAC, the projector that we use makes this little noise, and for some reason that often is really distracting to me. So it's this tiny little thing, but it sort of gets inside my head. And I think if an ambulance can go by that can upset you, or lots of different little tiny things that you might not even be aware of, but this kid is freaking out and telling you that he's covering his ears or telling you that his ears hurt. So trying to look around and use your super sensitive hearing to try to figure out what's going on. Smells, foods. A lot of kids with autism have dietary restrictions, so being careful. Caitlin will have that information, but being careful about giving snacks and stuff like that.
When we talk about attention, in my situation, I have a child who seeks all of that also. So you may have the downside, and then you may have a child who needs the deep pressure and
Yes.
that needs the stimulation because they're understimulated.
Yes, and usually it's one or the other. So she's sort of talking about a big bear hug or something. Sometimes when kids get really upset, I don't know if you guys have ever heard of something called a weighted blanket or a weighted vest. Sometimes just that pressure can calm you down, sort of like getting in a bed at night and having the covers on you. It just feels very comforting. So I worked with a kid once who would, when he was starting to escalate, would give you his hand, and he wanted you to sort of push on his hand, and that, I guess there's a pressure point there, and that is what he could take some deep breaths and calm down. So hopefully that would be information that you would have from Caitlin before you got started, but knowing that there are sometimes little tricks. Parents are always the expert on their child, so if they've told you something works, it's probably going to work, and it's not worth trying to figure out something else. At least try that first. Something else with autism, I think generally in the public eye, when you think about autism, a lot of people think about problem behaviors, or a kid that's flapping their hands. And not all kids, autism is a spectrum, so not all kids are going to have problem behaviors, but that is something that can occur, especially if you're asking them to do something that they don't want to do, or a sensory issue is happening. And it may not always be obvious. So again, putting on your detective hat and really trying to look at the situation and say, okay, what happened right before you got upset? Did something happen after you started screaming that's escalating that? And once you figure out what it is, try to get rid of it. either remove the stimulus or remove the child. We talked about this a little bit too. If they're having trouble understanding what you mean, saying it over and over and over again louder is not going to help. Think about the way that you're saying something. Are you saying it in the most literal, direct way that you can say it? So would you, this is another example, a personal example, would you like to take out the trash? What am I trying to say to you? Would you please go take out the trash for me? I have a client who, he just said, no, I wouldn't. And we had to talk through, in English, we especially in the South, we say things like that to be polite. I'm giving you the illusion that you have a choice, but really I'm saying, go take out the trash. So if you've said something like that, you may have to back up and say, no, I mean, I really need you to go take out the trash for me. Another thing that I think is really important is if you have that list from Caitlin of things that are going to cause an issue, try to be proactive. So if I know that a loud noise is really going to upset you, maybe we avoid singing the song where everyone's clapping really loud. Maybe we just don't sing that song today. And I think really doing anything you can before the meltdown happens is going to work in your favor, because if you get to a place where that kid is super upset, it can take, for some kids it can take hours for them to come down from that. So your job in childcare is to make it a positive experience, not only for the child, but for the parent who's entrusting you with their child. So if they come back and their kid is in a full-blown meltdown and you're like, this has been happening for the past hour, that parent's going to be really reluctant to bring their child back to that experience for the next time. So doing what we can on the forefront so that everyone is having a good time. Something else is making rules for everyone. So we often think about individualizing things, making that schedule, writing down a schedule of what's going to happen for the kid with autism, but these are all strategies that you can use with everyone. So if you make a big schedule, let's have some time and sit down and talk about what we're going to do during this hour while your mom and dad or grandmother or whoever is gone. And you have a whiteboard and you write the schedule on the whiteboard, and maybe you still let the kid that's really having an issue with routines mark things off, but it's there for everyone to see. Neurotypical people like schedules. We like to know what's going on. As I'm probably going over a little bit, if I made this last until 8 o'clock, you guys would all start checking your watch and being really antsy. And letting the individuals that you're working with have some choice and some input into what those rules and expectations and activities are going to be also helps take some ownership, and that makes us all feel like it was our choice. And if you can't figure it out, if you've gone into full-blown meltdown mode, Caitlin's always a great resource. Get help if you feel in over your head. It's always better to ask for help than to try to continue to figure something out and possibly make things worse. And that's it. Who has a question?
Can you give an example of like an opportunity you used, something that keeps them calming down? Like, let's say if they like a certain smell or something that you know they like, and you know that ahead of time. What's a way you can use that? Would it be just for when they're like acting out, or could it be like a daily thing?
I think that's something that you would want to talk to the parent about. If they, like a lot of parents like essential oils, if they are like, oh, the lavender smell helps calm them down when you ask them to go to the bathroom, you would sort of prescribe for that child what the parent expected of you. I think if you're going to be doing childcare with Caitlin and seeing these kids sort of over and over again, you're going to pick up on those different things. But it's not your job to decide necessarily what's best. It's your job to sort of follow through with a plan that someone else has set for you and keep that kid happy.
Most of the time, they're going to avoid smells. It's smells that they don't like, and so they won't eat certain foods because of it. Or, I don't know, I had a teenager that we couldn't figure. Her mom was redoing her bedroom, letting her pick out the paint and the furniture, and they were going furniture shopping. They were all excited. She would walk into a store and then walk right back out. And they could not figure out why she wouldn't go pick out furniture for her new bedroom. And she couldn't tell them why, because she hadn't processed everything. But by the time I saw her, it was the smell of a furniture store that she didn't like, which I don't know. Now I notice there's a smell. I didn't know there was a smell. But after that, I'm like, what is that smell? But anyway, so I think it's more avoiding smells that you would come and experience with children rather than them wanting to seek certain smells.
Yeah, with our childcare events and stuff, our parents will usually send with their kid like a backpack of all of their like preferred things. So, I mean, parents are really good. Obviously, they are your best resource. They know their kids the best. And so we when they sign up for events, they have an option to fill in information about whether or not they're runners, whether or not they're potty trained, tidbits to help them have a great time, things to do if they have a meltdown. We have actually had a really good success with our pianos. I've only had one child who was really not having a good time, and it was because we were at the YMCA, and it was a really busy, really wild, very loud, vibrant environment, and he just could not handle it. So I ended up calling Mom about 45 minutes in and just saying, I just want to let you know he is still having a meltdown. We've tried, this, and this. And she ended up just coming back because she didn't want him to have this awful 4-hour experience so that she could have her night off. So that's the only kid that we've had that happen to. Otherwise, all the kids have stayed. And they all typically have a really good time. But yeah, our parents are really good. They send a lot of kids, they love technology. So they'll bring their iPad, or they'll have, their favorite book. Some kids like their blankie, whatever it may be. They send that with them. So we're all prepared for the most part with that stuff.
I will, to add to the smells, don't wear perfume or smelly lotion if you're doing the childcare. We had a plug-in in our waiting room, and I had an adult client who told me, you got to get rid of the plug-in. I can't come in with that. So yeah, don't wear a lot of good smelly stuff.
I was wondering what you're saying there. What about things like certain sounds?
Sound working to make them feel better? That's a good question. No, I mean, a lot of times there's music that they enjoy. Usually it's, and maybe it's trying to avoid situations so I know more about what they don't like as opposed to what they're liking. But loud sounds, they're usually avoiding. I don't know if soothing sounds.
So if you're talking about a comfort item, it could be something that feels good to them, and that could be very individual, or a toy that they're comfortable with. And so you have to use your judgment, right? Depending on the activities that you're doing, when you're going to introduce that, is it something they can just have with them that's not disruptive? Or if you feel like in your situation it's a little disruptive, you might say, and you're anticipating some anxiety, you're seeing it happen, you might say, let's take that comfort item and how about we play with that for specifically, like Megan said, this amount of time, and then we're going to try this, and when it's done, then you can do that again. And if it's not the item, it's talking about the thing that they persist at, that they obsess about a little bit, because that's calming to be able to talk about their thing of interest. And so, but you just have to use your judgment every single time to see how it fits into your situation.
Well, and
like
in the
a puzzle.
childcare situation, you guys aren't, learning RX is a little different because you're having to get tasks completed. But for a childcare situation, thankfully, you're not training them for potty training or for eating certain foods. So let them have whatever it is that makes them feel good and have fun, It's supposed to be fun.
You're supposed to have fun too.
Yeah. Talk about what they like to talk about and play what they like to play. And if they need a soft blanket the whole time, that's cool. Yeah.
What else?
I guess I have a question, and I don't know how long you'll be taking to this for you.
Sure.
But I've had situations with me in childcare and nursery setting where I was fairly sure that the child was on the autism spectrum somewhere. How would I approach a parent about that?
Are you certified to diagnose autism?
Absolutely not.
Yes. Then I would say be very careful about what you say. Saying, I think your kid has autism, A, is going to freak that parent out. B, maybe it's something they've already been working towards. Maybe they're already working on getting a diagnosis, and you noticing it brings up a lot of anxiety, like, oh God, everyone knows. You could, if, Caitlin, someone, if you're doing childcare with her, or in that situation, a lead teacher, or someone that sort of has some authority, maybe bring it up to them and say, I just sort of, I went to this autism training, they were telling me about all these different characteristics and weird things that can happen, and I just sort of noticed that in this child. I just wanted to make sure that you also wanted to see if you also were coming up with those characteristics. And they might say, oh yeah, we've already addressed it, it's not an issue. I would just be really careful with using the A word as parents, especially with really little kids.
It's scary for parents. So even, just mentioning it raises a lot of fear for them. And going to a person above you and mentioning it, I think, is a good idea. Even, parent to parent, I see a lot of families. And so they'll be like, oh, I know my, neighbor's kid has autism, I just know. And they're trying to figure out how to approach that subject, even on that level. So it's difficult.
A lot of times, once they get to school, it's a teacher's job to start that process, because they can talk about specific deficits that they're seeing. This kid's not making eye contact, not able to interact with peers. They sort of have this list and are probably better able to decipher that situation and can offer a solution. You saying, I think your kid might have autism, that's all you have to say. You don't have sort of somewhere to go from there, which is probably the scariest thing that a parent can hear. Sorry, I think your kid has autism, but I don't know what to do about it.
Any other questions? No? If you get a chance to work with somebody with autism, they're like my favorite. They're the coolest people. Yes, it's take the opportunity if you ever get the chance to have that experience.
And I think you either immediately fall in love or you decide it's not for you, and both things are okay, but I think once you know. Alice and I both were like, we're just cool to do this forever.
Thank you all for coming.
Yeah, thanks for coming.
We'll be around if you have questions. Certificates are up here.